like a pain, like say in your joint or tunnel or something, like I know it's different for every person, but how often do you think you should go, and like, when do you think that pain would start going away?
Okay, so that's a really good question. Like I said, the healing really comes from that person. As much as I would like to say that I can take credit for a person's healing, it has nothing to do with me. I just kind of direct things along the way, and I give people a lot of information to help them heal themselves. So if somebody comes into me and say they have carpal tunnel, well, I'm going to say, what are you doing that's causing the carpal tunnel? Okay, you're a hairdresser and you're constantly using it. Got it. Can you give it a week or two to just rest, and let's do some treatments? If that's not possible, their recovery is going to take a little bit longer. If they can come in on a more regular basis and give it a little bit of a rest, usually 2 weeks. And what we do is we usually do twice a week. I had a woman who came into me who had tennis elbow. She wasn't a tennis player, she was a flight attendant, and so opening like the cans and things like that on the plane and moving things over her head, she was constantly using it, and she worked, I think, Friday, Saturday, Sunday. So I would see her once a week on Thursday before she'd go on her flights out. And she came in, I think, maybe 3 times, and her tennis elbow was like 80% reduced. And I think we would have gone 100% if she would have taken a week off. But, you know, people have to work, it's just a part of life. So it really just depends on what the person's doing. And then, of course, like the lifestyle that they live has a huge role in their healing. So if they're not sleeping at night, they're putting junk food in their body on a daily basis, it's going to be a little bit harder to get their chi moving properly. But we educate on all of that. Go ahead.
And how long is this one session?
The first session, I usually ask for about an hour and a half, just because I get like a full history, and even if somebody comes in and they've got all these labs and blood work that they're giving me, what I have to do is kind of like take that and then put it all through my Chinese medicine lens and look at it in terms of qi and yin and yang and that sort of thing. So I usually sit with them for about 30 to 45 minutes going over everything, and then they get a treatment on top of that. So it's about an hour, hour and a half.
And so if you had neck pain, which I do,
yeah.
Do you put the needles just in the neck, or do you?
No, I probably wouldn't even go in your neck. Okay. Some of the best treatments actually come when you're, like, there's a point right here for your lung, and that's actually one of the ones that comes up to the neck. So just rubbing on here is usually, and what's really funny is you see people doing this all the time. Like, I have a friend who's Brazilian, and she told me that her teacher gave her some great advice when she was young. She said, nothing is by chance. And so when you see people who are trying to focus and they're scratching their head, that's one of the points we do 4 needles on the top of the head. It's called Xishin Kong. And what that is it raises up all the yang qi so that you have better thought processing in the brain. So for neck pain, no, I probably wouldn't even use your neck. Unless there are times, like if people have scoliosis, a lot of times we go right along the spine, and it actually kind of helps relax the muscles along there that are being pulled because of the curvature. Anyone else? Go ahead.
So I have a question about the helping with the menstrual cramps.
Yeah.
How long does something like that take?
Okay. Again, it really depends on.
It's really bad.
Yeah.
Every month.
Yeah. There's a couple things that I can tell you, like just right off the bat, and every woman in here should hear this. No icy drinks around your period. No exercise the day of your period. You don't really want to anyway. You want to be in fetal position. I get it. That's because you want to be warm. And you really need to rest. Like, that's the time when your body, okay, historically, there's a great book called The Red Tent, if you guys haven't heard about it. But anyway, it talks about the history of women and how they, and it's a story beyond that. But these women would go into the red tent and they would rest, and it was communal. All they would do is braid each other's hair and rub each other's feet with oils. Okay, now how nice does that sound?
It should be the next event.
Yes. Yeah. Yeah, and you really just need that time to yourself every month. Honestly, I don't see, if I ruled the world, I mean, I would definitely make menstrual cycles like you got to take the day off, have that moment to reflect. We wouldn't bite people's heads off. We wouldn't do crazy things. We wouldn't eat crazy foods that hurt us in the long run if we could just get the rest that we need. So, okay, so how long would that take to treat? It just depends. Again, it depends on what you're eating, what you're doing, but no icy drinks, no swimming in a pool around your period. If you look at the Chinese girls in the Olympics, they always have these little like patches on their low back when they're in the pool. They're heating pads, and they have herbal herbal things, herbal substances in them that basically warm up that area as well, because the low back, it's the kidney area, which in Chinese medicine relates everything to the menstrual cycle. But in addition, all the low back nerves innervate the uterus. So yes, you want to warm that area up. You don't want things cold and tight. I mean, think about the way your muscles react when you go out into the cold. They do this, right? It's not comfortable. You don't want your uterus doing that. You want it to flow. So, yeah. Ladies, I really appreciate you letting me come out here and talk about what I love to do. So I hope I wasn't too crazy with the Chinese medicine talk, and I hope you enjoyed it. Good. All right. Thank you so much. Thank you.